Hello and welcome back to the Bryan Laskin podcast. I'm your host, Dr. Bryan Laskin. And as we've talked about before, dentistry is under pressure. We have tight margins, our labor costs are rising, and we have accelerating consolidation. And so the biggest growth lever that we have in dentistry isn't adding chairs or cutting overhead, it's clarity. And when patients feel connected, clear, and confident, they follow through with treatment. And when patients follow through, revenue becomes predictable, and that's why we are exploring the operating truth of care more, make more. So today I want to talk about something that almost certainly you are not measuring correctly. It's the post-visit window, the hours and days after a patient leaves your practice, because most organizations think that the appointment is the event, that when they're in your chair, that's where everything happens. It doesn't. That's not it. The appointment is not the event. The decision is the event. The decision to either go through or not go through with treatment, or to not make the decision, which is a decision in itself. And most decisions happen after the patient walks out your front door, right? Dentistry has been built around chair time. We focus on optimizing chair time, production per hour, collection per visit, scheduling utilization. Everything revolves around the appointment, but the most valuable behavior, the most valuable moment that we have in dentistry doesn't typically even happen in the operatory. Obviously, outcomes, I'm talking about not the delivery of dentistry. If you do great work in the operatory, it's huge. That's paramount. But what I'm talking about is the most valuable, meaning revenue in your practice moment that happens in your practices. It doesn't happen in the operatory. It happens later when the patient is at home alone or with their spouse, when they're thinking, when they're ruminating, when they're talking, right? The patient sits in your chair. You diagnose a treatment, any treatment. You explain it in great detail, everything, the benefits, the risks, and they nod. And they're agreeing with everything you say. They maybe even say yes. Oh, that sounds right. And they might even schedule, or they might need to say, I need to think about it. Either way, leadership often assumes that the outcome is determined in that room. If you're a dentist, you probably think that patient's going through with treatment because they were nodding and they accepted the treatment by scheduling it that day. That is not true. Because once they leave, three forces start immediately working against you. These forces we're going to break down a bit. Force number one, memory decay. People forget details quickly. I do, right? We all forget the details. Clinical terminology fades. If you explained something, even if they got it, that fades. Urgency definitely softens, right? I've said it before. When they're in your practice in your operatory, it's like they're by it's winter in Minnesota right now. They're by the fire and everything's warm, right? But as every step away from your practice, they start cooling. The numbers blur. How much was the insurance? I don't remember, right? What felt clear in the office becomes vague at home. Have you had that experience? So that's force number one. Force number two is external influences, right? Maybe the spouse asks a question, or friends say, hey, I had a root canal done. It was the worst thing that I've ever done in my life. Have you ever heard that before, right? They go to Google and get conflicting information. ChatGPT gives them a totally different perspective than what you happen to say in the chair. Online reviews, they start Googling, is a root canal worth it, right? You have no idea if you haven't actually looked to see what people are saying. And if you did, you might be looking at platform A and they're looking at platform B. You think they're on ChatGPT, but they're on Reddit, right? And without reinforcement, doubt grows. They don't get more clear and confident without reinforcement. They get less. That's force number two. And force number three is emotional cooling. When they're in your office, there is immediacy, but at home, there's comfort, right? Comfort reduces urgency. When you're sitting there talking to them, it's easy to say yes, but when they're at home, it's easy to say no. And urgency is what drives follow through. Now, most groups don't manage these three forces. They assume that the appointment did the work, but in reality, it's the post-visit window that determines whether diagnosed treatment becomes completed treatment. And here's where it becomes an enterprise issue if you have 50 or 100 locations and none of them have a standardized post-operative visit appointment or post-visit reinforcement system. You are leaking revenue at scale. So let's put some math to this behind. If you have just 2 patients a day in each location, 2 patients every day out of probably, let's face it, the average practice has over 20. So this is like 2 patients a day that delay or cancel diagnosed treatment because they had erosion in their confidence after the visit. What does that look across your network? 2 patients per day across, let's say, 80 locations across 20 working days. That compounds quickly. And again, there's no line item on your P&L, I would guess, that says confidence erosion. Patient said yes, but didn't, but put it off. Not on your P&L. It shows up as lower case acceptance, lower reactivation. Maybe they fall out, and lower lifetime value. And leadership often responds by blaming people, providers, not the right scripts. But this is not a provider issue. It's a systems issue. And in most DSOs and group practices, what happens after the patient leaves? A printed treatment plan? Maybe. A lot don't even do that. Maybe you're ahead of the curve and you give an automated reminder, 1. Maybe a generic follow-up call, right? But is there a structured clarity reinforcement system? Is there a standardized recap that ensures the patient understands what was diagnosed, why it matters, what happens if they delay, and what the next step is? Is there reinforcement of the confidence that they felt when they were in your practice? Or is there silence? And let's face it, silence is expensive and puts people at risk of the worst outcomes. Silence allows doubt to grow, and doubt delays decisions, and delayed decisions lead to higher risk for that patient having a negative effect. And the post-visit window is dentistry's most undervalued asset because it is pure leverage. You've already diagnosed the treatment. You've already built the relationship, and you already invested in the chair time, in the words that were said, in the training, whatever you're doing now, that's already been done. The incremental effort, very tiny, to reinforce clarity is minimal compared to acquiring a new patient, yet most organizations invest heavily in marketing, but don't have a system that follows the patient after the visit. And almost nothing happens then with post-visit reinforcement. This is backwards. This is where our care more, make more tactical. Care more is the post-visit window, meaning 3 things. Connection does not end when the patient stands up and leaves. Patient who feels followed up with intentionally, personally, clearly experiences continuity. Clarity must be reinforced, not assumed, and a clear recap in simple language where the patient is on their mobile device is the best place, with visual reinforcement, with their next steps outlined explicitly, right? That's what we need. Confidence must be rebuilt after the emotional cooling period, right? Not a sales push, reassurance, stability, certainty, as much certainty as you can give. And when operationalized across locations, you'll see behavioral shifts in your patients and in your teams. Increase revenue because follow through increases. Recall stabilizes because patients feel guided and cared for. And referrals grow because the experience feels organized and thoughtful, leading to advocates in your patients. This is not, I want to be clear, it's not about structured reinforcement. And there's a difference between don't forget your appointment and here's why this matters and what happens next. One is administrative, the other is behavioral. So we want to care more and automate that. The DSOs that understand this will have more predictable revenue because they're managing the decision window, not just the appointment. So let's connect this back to enterprise risk. If treatment acceptance fluctuates wildly between locations, you have variable risk. And as we've talked about, variable risk leads to reduced value. If recall compliance drifts silently, you have retention risk. And if patients disappear after diagnosis, you have lifetime value erosion, which, of course, all of this leads to lower enterprise valuation. And by the way, care more, make more. That's what's so great about dentistry. When done right, everybody wins. And all of this happens primarily in the post-visit window, not in the chair. So here are your questions today for every leader in dentistry that you should ask. What happens to patient confidence 24 hours after the appointment? Is that process standardized across every location? Can we measure follow-through behavior after diagnosis? Can you measure after diagnosis? How many patients leave with diagnosed treatment and never return? In post-visit communication intentionally, is our post-visit communication intentional or is it automated noise? How does it make people feel? And most importantly, if we improve post-visit clarity and confidence by 10% across every location, what would that do to case acceptance and recall? If you don't know the answer to that, you are ignoring one of the most powerful growth levers in your organization. The DSOs that win this decade, again, will not be the ones that add the most chairs. They'll be the ones that manage behavior most effectively. And behavior is shaped in moments of uncertainty. That post-visit window is uncertainty. So manage it, standardize it, operationalize it, because when you care more in that window through connection, clarity, and confidence, you make more revenue, recall, and referrals. Dentistry has been obsessed with chair efficiency. The next wave of winners in dentistry will be obsessed with decision. Remember, until next time, organizations that care more, make more. Now, look forward to talking to you next week right here on the Bryan Laskin Podcast.